Have you ever visited your doctor or other healthcare professional and felt as though every ailment came down to your weight or ultimately needing to lose weight? You want to feel safe in your doctor's office and as though weight stigma isn't coming into play in that relationship. In today's video, I'm going to be covering how you can find health at every size doctors to help you along on your journey. On this channel, you'll learn about health at every size and how to fit a health at every size approach into your lifestyle. You'll also learn about why you might be overeating or struggling with your weight and the science behind this. I'll give you tangible take-home strategies that you can use to improve your relationship with food and your body. If this sounds like just what you need, subscribe to the channel and hit the bell in the top right corner so you're notified when I publish a new video. I post a new video every Wednesday. I'm Meredith MacKenzie of Parallel Wellness. I'm a registered clinical counselor and an intuitive eating coach. I've helped hundreds of women to repair their relationship with food in their bodies so that they can go on to live healthy, successful, and fulfilling lives with freedom from food and being connected with their bodies. If you are currently looking to work with a new healthcare provider, finding a primary care physician, anything of that nature, we need to first acknowledge that doctors are in limited supply. In North America, it can be really difficult to find a doctor, not only that meets your needs, but just has openings for patients in general. But in today's video, I'm going to go through the steps that you can take to try to find a healthcare provider who does align with your values and is health at every size informed. The first place you can check out is the ASDA website. ASDA stands for the Association for Size, Diversity, and Health, and it is the home of all information on health at every size. So you can go there and check out that, but they also have a directory list of professionals who have paid for a subscription or paid for posting of their practice on the ASDA website so that you can find a physician who meets the criteria for somebody who follows health at every size. Now, I will say I've done a search for myself, and as a Canadian, there were no doctors on the list. And so that is disheartening, but I also think that the intention is really good. And my hope is that in the future, as more and more professionals learn about health at every size, that they will pay the $100 to be on this list and be available to patients and clients who would be looking to work with someone who comes from a health at every size approach. Another thing you can do is try to look for a professional who was more recently trained or just recently came out of their medical school training experience. And the reason for this is that health at every size is finally now infiltrating into the training programs for medical professionals. And Hazel Jonas, who is currently one of our master's students at Parallel Wellness, has been putting together and curating a podcast series for us, which I will provide a link in the description box down below where you can find the waitlist or to just even start listening to the podcast now if it is published at the time you're watching this. But she actually spoke with a doctor who is in the training process, I guess a medical doctor candidate, and said that health at every size is something that they're learning about in their training programs. So whereas your experience in the past might have been that doctors who follow a more traditional approach of medicine are much more focused on weight and, pushing weight loss and encouraging weight loss as part of a treatment plan for other health-related issues, this would be a really good place to start, knowing that these newer doctors might have had exposure to health at every size information within their program. Now, this being said, we do need to recognize that all doctors are human beings and human beings have biases. And so just because they've received that training doesn't necessarily mean that they will follow it or that they adhere to it or even really, incorporate those values into their own value system. So as I go through this, you're going to learn more tips about how to look for this particular type of practitioner, but that is one place to start. My next tip is to just go to Google and type in health at every size doctor in the city that you live in or a surrounding city. And this might sound super obvious, but the reason I'm suggesting this is that people who are, being intentional about their practice and want to make sure that they're connecting with patients or clients who are looking for somebody who offers a health at every size approach are going to be intentional about the copy on their website. And so what that means is they're going to make sure that those words are included on their website so that when somebody lands there, they recognize that, oh, hey, this is somebody that's a fit for me and our values align and I'm going to probably enjoy working with them. And so that intentional inclusion of health at every size words on their website is going to trigger Google to recognize that as something to, draw you to when you put that search into Google. So try that out, see how it works, and let me know. I think that if we can start collecting some information, even just in the comment section down below, about where you found doctors in your area who take a health at every size approach within their practice, that would be so helpful for other people to know about as well. Now, I want to know about your experiences working with your medical professionals, because I have been quite lucky to find a few that I don't think they actually identify themselves as health at every size professionals, but just you can very much see that that is a part of their value system in the work that they do. And so I have been super fortunate to have worked with a midwife and my primary care physician who both take that approach in their work with me. What has your experience been like working with your current primary care physician, or even somebody in the past? Was it positive? Was it not so positive? And what was it that they could have done differently? So if you have an experience, share it with me in the comment section down below. My next tip is to ask the professionals that you're already working with who do take a health at every size approach with their care with you. You know, if you're a part of a medical community or you're providing referrals back and forth to different professionals, you're likely to align yourself with other professionals who share your value system and that you know you can trust if you send your clients or your patients to, that they're going to be well taken care of and that they're not going to be harmed in some way. And so if you're working with, say, a counselor or a doctor or any other professional currently, and you really appreciate the approach that they take to their care with you, definitely ask them, do they know of another professional for whatever it is that you're specifically looking to work on that might align with health at every size? And you might be surprised to find out that they have a list. And so go ahead and ask them. I am all about finding a community that works for you, and I try to cultivate that myself within my own Instagram and in the comment section on this channel, but you can also find communities that really are aligned with health at every size in different areas on the internet. And the first one I'm going to suggest is Aubrey Gordon, and she is at Your Fat Friend, which I will provide the link to her Instagram in the comment section down below. And so Aubrey posted something on her Instagram quite a while ago where she was asking her followers to share where they found their health at every size practitioner that they were working with and to create a list within her comment section. And so I'm going to provide the link to that post in the description box down below as a place for you to start and go ahead and add to it, right? This is something that can continue to grow. And I'm sure if she sees that people are continuing to engage with this post, that she'll likely do one that's more up to date. The other place to look for health at every size communities and to find other people that are like you and, feel aligned and, share the same value system is Facebook. And so there are several groups on there. One that I'm actually a member of is the Health at Every Size Moms Facebook group. There is also a Facebook group by ASDAH where you can also connect with other people who want to live a health at every size lifestyle. And so in those groups, there's lots of questions that you can ask and have answered and just have people that have been really working on this for quite a while. And it's also a great place to be asking, okay, I live in this place. Does anybody know of a physician that I might be able to work with? So start with those groups as well. Now, going back to the fact that finding a healthcare professional can sometimes just be really difficult, we sometimes can't be choosy. We don't have a lot of options. We need to be able to see somebody who lives close to us or works close to us, and it can just be difficult. So I also wanted to provide you with the option that even if your practitioner doesn't necessarily advertise that they work from a health at every size approach, there are some questions that you can ask them to get a sense of how they practice and whether or not that will be a good fit for you. I have created a download for you and it's in the description box down below, and it includes a few, little tools that you might want to have on this health at every size journey that you're on. And one of them is a list of questions that you can ask your healthcare provider in an interview. I think a lot of times we get caught up in our relationships with our medical doctors because traditionally medical doctors have held a lot of power. But just like any other professional, you are hiring this person to work with you. You are paying for their paycheck, whether it be that you are directly paying them yourself or your benefits package or your insurance package is paying for their services. So you do have the right to ask questions, to get information from them, and to learn if this person is going to be a good fit for you, which I know it takes a lot of assertiveness to be able to do that and to wrap your head around that, but I do encourage you to have a conversation before you commit to working with a healthcare professional to see if they will be a fit for you. On a super basic level, when you are first working with a healthcare professional, you can just simply ask them, are you health at every size aligned? And if they are not familiar with that term, that's a good sign that they're probably not, because even if they have some of the values, they are going to have some blind spots. But it might also promote them to do some research and learn a little bit more about what health at every size is. So never a bad question to ask. And if they do say yes, you can ask them, well, how do you bring in the health at every size principles into your practice? And let them answer that. Again, not everybody is used to talking about these things all the time, and so they might stumble a little bit, but hear them out and hear how they see health at every size coming into their practice. And then finally, another really important question to ask is, how will my healthcare and my treatment and the work that I do with you be discussed in terms of my body weight and weight loss and other health promoting activities? And so this is a way of, really determining if this person puts the value on weight and weight loss as the way of promoting health, or if they do in fact recognize that there's other health promoting behaviors that you could be engaging in that would improve your health overall. And it's a good way of kind of teasing out if they are health at every size aligned. Now, if you found this video interesting, I want you to click the link in the description box down below where you can get on that wait list or listen to the podcast by Hazel. Super excited to be sharing this mini series with you on all things health at every size, where we're interviewing a bunch of different professionals on their approach to health at every size within their practice, and maybe some of the things you haven't considered about the whole health at every size phenomenon. Health at every size is also really aligned with intuitive eating, and I will get into this in the next couple of videos coming up. But if you are interested in learning more about how you might be able to practice intuitive eating in your life and find freedom from food, to reconnect with your body, listen to your body's hunger and fullness cues, and manage some of those emotional triggers to eating, I invite you to book a call with me. Again, link is in the description box down below, where we can discuss more about your experiences and possibly joining my One Body to Love program, which is a small group program for women where we talk about all of those things I just mentioned. And so I invite you to click that link and book a call with me today. If you found this video helpful, let me know by giving a like and subscribing to the channel. And again, I publish new videos every Wednesday, so I hope you come back and check out the one next week. If you know of somebody else who would be, benefiting from learning more about health at every size and how they can find a medical professional who is health at every size aligned, send them this video, share the link with them, and I hope you have a wonderful day.